thought that was it. I really thought we were going to lose him that time.
It felt like something had been ripped from the inside of my chest.
Let it be me, not my child.
I started to think, can I raise our son by myself?
Jack cut his first teeth. They were pointed.
It's not possible that there's not somebody out there who can help us.
Next, 3 medical mysteries that defy the experts. Little Jack Hagelin is on the brink of death, suffering from malnutrition and strange infections. But his doctors can't find anything wrong, with the exception of a possible milk allergy.
I knew there was something else. Deep down, I knew there was something else.
Brian Sloan is an active, athletic father of 4 until mysterious pains in his chest and extremities leave him crippled and desperate.
I can picture him holding his head in his hands and saying, I can't go on like this.
And Montessa Pittman hasn't been sick a day in her life. Then, within a matter of months, she's in the hospital, fighting for every breath.
I was an invalid, just that fast.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. September 2002, Roy and Charlotte Hagelin welcome their second child into the world, a baby boy named Jack.
Everything about him, his hands, his feet, everything was so perfect. We unwrapped him and then wrapped him up again.
Basically, everything was full steam ahead. He was eating well. He looked like a normal, healthy baby.
But 2 weeks later, things begin to change.
He started spitting up. Then we also noticed that his bowel movements started to become loose.
He was looking very pale, not looking well, but it happens occasionally. Nothing to be alarmed about.
The Hagelins never experienced these problems with Jack's older sister, Christina, so they decide to take him to their pediatrician.
I thought that he might have had gastroesophageal reflux, so we thickened his feedings and sent him home.
Jack was okay for about a day or so. And then the spitting up started to become a little bit more than spitting up. And the diarrhea started to become a little bit more frequent.
8, 9, up to 10 diapers in a day. I mean, it's been as high as 30 diapers in a day.
For the next 3 weeks, Roy and Charlotte are on the phone with Dr. Levy every day, trying to find the right formula for Jack. But nothing seems to work, and Jack is losing weight rapidly. Terrified, they bring him back to Dr. Levy.
When I saw Jack at 5 weeks, I was horrified at how his condition had deteriorated.
He said he is severely dehydrated. He had lost 2 pounds and said he needs to get fluid immediately.
The Hagelins race to the emergency room, where the doctors tell them that 5-week-old Jack is literally starving to death.
The medical term was he was in malnutrition dehydration because he was not taking anything in.
You just think, oh my gosh, what did I do? Did I do something wrong? Should I have brought him to the doctor sooner?
Dr. Levy said, I don't know what's wrong with Jack. He needs to be put into the intensive care unit.
Jack is immediately admitted and put through a battery of tests, but doctors can't find anything wrong. Just as a precaution, they start him on a course of antibiotics. After 2 days, Jack still can't keep his formula down and appears to be barely hanging on. Doctors speculate that it could be an allergy to milk protein and put him on a milk-free formula. 10 days pass, and Jack appears to stabilize. Then, a bizarre new symptom begins to develop.
His right foot started to swell. And they just monitored it. However, the swelling started to become a little bit more prevalent. It went into his whole right leg, then it went into his left leg.
That eventually just stayed in both legs, and his legs came to look like tree trunks.
The doctors think the swelling is somehow related to Jack's other symptoms, but they don't know how. 2-month-old Jack is put on steroids in an effort to reduce the inflammation. It helps a little, but his legs remain noticeably swollen.
This was something beyond normal, beyond any stories that I had heard.
But for Charlotte, this is all too familiar. 39 years earlier, her twin brother died after displaying bizarre symptoms just like Jack's. Then, 13 years later, her sister's son succumbed to a mysterious illness, again with similar symptoms. Now the same killer seems to be attacking Jack.
Jack's symptoms certainly coincided with that family history, but we could not come up with a true diagnosis for them.
It scared me. It scared me. I prayed that I wouldn't have to go through what my parents had gone through, what my sister had gone through.
After 2 months in the hospital on his new milk-free diet, Jack finally seems to be stabilizing, so the doctors send him home.
I was hoping that it was done with, like, okay, we dodged this bullet, we found out what was wrong, we're moving forward here, and, we'll go on to being normal.
But Jack is only home for 2 weeks when it starts all over again. He can't stop vomiting and suddenly spikes a 104-degree fever. Charlotte rushes him back to the hospital.
They found out that he had H. flu bacteremia. Again, this far-out thing that I had never heard of.
The doctors immediately put Jack on intravenous antibiotics to get rid of the H. flu, a common bacterial infection. After a couple of days, he begins to get better. But as the months pass, the cycle continues. Jack is spending more time in the hospital than he is at home, constantly on the brink of starvation or fighting infections, and no one can figure out why.
We saw gastrointestinal, immunology, allergy, pulmonologist, cardiologist, a rheumatologist. Every specialist there is, we have.
Nobody was giving me a solid diagnosis other than a milk protein allergy. And milk protein allergies don't cause infections.
I knew there was something else. Deep down, I knew there was something else.
Then, as Jack approaches his first birthday, when Roy and Charlotte think there simply can't be any more surprises left, Jack manifests his most bizarre symptom yet.
Jack cut his first teeth, and they were both pointed.
Toothpick point teeth.
They were like fangs, really.
The Hagelins are horrified and scared for their son.
We were afraid he was going to hurt himself, so we took him to the pediatric dentist.
The dentist believes there's a reasonable explanation for the strange teeth.
The dentist felt that this just could be a result of all the medication that Jack was on.
He files them down and tells Charlotte that it will be easier to take x-rays when Jack is older. But Charlotte is overcome with dread. She remembers that her nephew had cut a few teeth before he died, and they were pointed, just like Jack's.
The worst fear was that they were going to lose another little boy in their family.
I wanted Jack to be different. I wanted his case to be curable, and I didn't want Jack to seem like he was doomed.
Two-year-old Jack Hagelin was born with symptoms eerily similar to a mysterious disease that killed 2 other baby boys on his mother's side of the family. He's been in and out of the hospital for the past year. Roy and Charlotte Hagelin now feel like they're in a race against time to save their son's life.
I searched high and low on the internet. I would stay up till 1, 2, 3 o'clock in the morning reading more medical articles than I ever thought I would read in my life.
We were sending him to the top specialists, not only in New Jersey, but all over the United States.
Then, in October of 2004, the Hagelins are referred to a top children's hospital in Ohio for a full workup. There they meet with Jack's new gastroenterologist, who sets up a series of tests with a team of specialists.
The following morning, a dental resident came in to the hospital room. And he kind of looked at Jack. He looked at Jack's teeth, looked at Jack's hair, and he says, "I think he has ectodermal dysplasia."
And I said, "What?" He said, "Yeah, this is a rare genetic disorder that affects the hair, the teeth, the nails, the skin, and the sweat glands." And he said, "Does your son sweat?" I said, "No, he doesn't."
But ectodermal dysplasia does not explain Jack's most serious symptom, his digestive problems. And after 4 days of testing, the gastroenterologist has no explanation either.
He said, I do want you to see another doctor before you leave. And we stayed to see this allergist immunologist.
The immunologist reads Jack's charts and performs a thorough exam. Then she tells them something they're completely unprepared for.
She thought that Jack might have this rare primary immune deficiency that went along with ectodermal dysplasia.
And she said, well, I want to run some testing. She ordered some more blood work. And she said it would take several weeks before we would get those results.
Unsure what to think, the Hagelins take 2-year-old Jack back home and wait for the call from Cincinnati. But before the results are back, Jack suddenly spikes a fever and refuses to eat. Charlotte and Roy rush him to their local ER, where the doctor orders a chest x-ray.
He said, it looks like he could have pneumonia.
When they tell the ER doctor Jack's history, he immediately tracks down the immunologist in Cincinnati.
She said, Jack needs to go down to Children's Hospital of Philadelphia now. There's a doctor down there, Dr. Orange, who knows all about this immunodeficiency that Jack may have, and he needs to get down there because the pneumonia could be life-threatening.
So 2-year-old Jack is put into an ambulance and rushed to the Children's Hospital of Philadelphia.
It was so similar to my nephew. I thought that was it. I really thought we were going to lose him that time.
Jack's in the ambulance, Charlotte's in the ambulance, I'm falling behind, and I'm crying my eyes out. Hey, look, if this is it for Jack, do it quick.
When they arrive, Jack is admitted to the pediatric intensive care unit, where he is examined by Dr. Jordan Orange.
When I first saw Jack, of course, he was quite ill. He was skinny, he was breathing heavily. So first we treated his pneumonia, we treated his infections, and we tried to nurse him back to health.
Dr. Orange is also consulting with Jack's immunologist in Cincinnati, and he agrees that all of Jack's symptoms could be due to a disorder that weakens the body's natural immune system.
He really felt that Jack had this rare genetic disorder called Nemo.
I was like, Nemo? I said, that's a fish.
Nemo is not a fish, but it's a gene. And it's a gene that makes a very important protein in a cell called the NF-kappa B essential modulator. What that does, it's a master switch inside of cells. You need to be able to turn this switch on when you need these cells to do something like fight an infection. And you need to be able to turn these cells off when you don't want them to do something like attack your own body.
The Nemo gene is found in almost all human cells. In someone with Nemo deficiency disorder, the gene is defective, causing a communication breakdown between the cell nucleus and membrane. Without clear instructions from the nucleus, cells cannot function properly. This leads to massive organ and system malfunction. The disease only strikes boys, passing from mothers to sons on the X chromosome. Left untreated, Nemo deficiency is deadly.
Ultimately, the only way to confirm the diagnosis that I suspected was to do a genetic test of Jack's DNA.
3 weeks later, the test confirms what Dr. Orange already suspects. Jack has Nemo deficiency disorder.
So the mutation in Jack's Nemo gene results in a great number of problems. One is that their immune systems don't work. Part of Jack's severe diarrhea and an inability to tolerate food, essentially, was caused by one of these unusual mycobacterial infections that had set up shop in his gut and was actually wreaking havoc there. Another problem is ectodermal dysplasia. Children who have this don't sweat appropriately. They can get really high fevers and they can even die from these fevers.
In other words, Jack's bout with pneumonia could have been his last.
But if we had not made the diagnosis, it was very likely that Jack was going to die, and that Jack was going to die relatively soon.
Jack is started immediately on intravenous immunoglobulin therapy, also known as IVIG. These are antibodies derived from donor blood, and they give Jack the ability to fight infection.
There was an immediate change after Jack started his IVIGs. He was just a healthier Jack.
After a few months of IVIG and antibiotic therapy, Jack improved significantly.
He went from having hospital stay to hospital stay to hospital stay to almost having no hospital stays.
Once Jack is out of danger, Dr. Orange decides to test other members of his family. He discovers that Charlotte is a carrier of the mutated gene, as are her mother and sister. And after all these years, he finally solves the mystery of what killed Charlotte's twin brother and her nephew. It was Nemo deficiency disorder.
It made me feel very guilty that it came from my side of the family, but it was a breath of fresh air knowing that we finally have an answer.
Roy and Charlotte are astonished to find out how close they came to not getting an answer at all.
Nemo deficiency was impossible to diagnose because it was unknown, and it was only in late 2000 that it actually entered the medical literature.
Today, 1 year after his diagnosis, Jack is a rambunctious 3-year-old. But he isn't completely cured. Nemo is a very serious condition.
Jack's IVIG therapy does plug some of the holes that Nemo deficiency creates in his immune system, but it doesn't plug all of the holes. Any infection that Jack gets could be his last.
The next step is stem cell transplant therapy, where cells from donated bone marrow are transplanted directly into Jack's body. If it succeeds, it will give him a healthy new immune system. The procedure is scheduled to take place shortly before his 4th birthday.
He's a strong-willed kid like I've never seen before in my life. And that's the best part about Jack, because of his fight and his drive. I think that's what's going to put him over with the stem cell, too.
We'd like to try and give Jack life, and a stem cell transplant could give Jack the life that the other boys didn't have.
Doctors eventually traced Jack Hagelin's condition all the way back to his DNA.